So good evening to you all. Or if there's people in other parts, maybe Europe or even in Israel that are joining us, so good morning. Uh, so whoever's not familiar with me, I've been coming to Oakland for the last, been about 3 times to come give a course on Yamamoto scalp acupuncture technique. My name is David Bomson. I've been practicing acupuncture since 2007 and Yamamoto scalp acupuncture since 2009. And been working in the last 13, 14 years in a neuro rehabilitation hospital here in Israel, or department, which is part of a hospital here in Israel, the largest in the north of Israel, rehabilitation center with orthopedic and neuro rehabilitation, orthopedic rehabilitation. But the idea is that we integrate scalp acupuncture, Yamamoto scalp acupuncture, into the hospital, or with physiotherapy, occupational therapy, speech therapy, but it's very much integrated in a Western medicine facility. So all I want to speak about, why am I mentioning all this? Because while we go through the webinar, all what I'm going to speak about is actually clinical practice, that it's very much based on my clinical experience and the ideas of what I started seeing the connections between, in this case, the vagus nerve, okay, or what's called the polyvagal theory. If you've ever heard of the polyvagal theory, it's a theory how the vagus nerve is also very strong in connection to our emotional state, and how it also traumatic incidents kind of get stuck in the vagus nerve. I know this is becoming a new thing in the last 5-6 years, but this theory of the polyvagal theory has been running since about 1996, even before I even started doing acupuncture, by a physician by the name of Stephen Purges. Okay, who speaks differently about how the autonomic nerve system regulates the body. We have the sympathetic, and also how we have the parasympathetic. But the biggest difference is that if you have the sympathetic nerve system, which you have fight, flight, freeze, then actually the idea of freezing is actually got to do more with the parasympathetic state and less with the sympathetic, and how it switches from one to each other. So we're going to speak about that topic, but I want to speak actually about a very interesting case, or start with a case in my clinic, not in the hospital, of a female aged 33 that came into my clinic, which she suffered from she has severe pain throughout the whole body. When I did the diagnosis, post-diagnosis, or even where I used also Yamamoto in this case, started seeing that she's in a lot of stress. So you could say that she's triggered fight and flight. The sympathetic nerve system is being targeted and being fight and flight. And she said she's been like this for about a year, that the pain is coming and going. And the story, actually, what's interesting, when we started going into the story, started telling me the story in the intake, that actually about nearly a year ago, she came into the hospital because she had severe headaches, severe headaches, with kind of with a dizzy spell, or a feeling more of feeling unstable. And the first thing the doctors said, well, we think he has meningitis. Okay, so they done a lumbar puncture to see if she has meningitis, and actually the results came clean, that there was no inflammation or no virus whatsoever. But actually, from that moment, everything started to spiral downwards. And from that moment, she started getting severe pain throughout the upper neck. And that was for about 2 to 3 days. And then after about 2 to 3 days, the headaches kind of reduced and were lessened, and then she went home. And then again, after about 4 days, she started feeling these headaches started to come back with strong radiation throughout the upper neck, and also radiation throughout the upper extremities, mainly on the left side. That's why I keep going to the left side. After about a while, and then again, started getting to even feeling weakness in the hand. So again, she went back to the emergency room. And again, in the hospital, they diagnosed her, they looked at the situation, and they didn't, again, done a CT, MRI, and again, everything was clean. They didn't see any clinic or any picture. They weren't seeing any clinical picture. They only seen a clinical picture, but they weren't seeing anywhere it's coming from and the cause. And again, they gave her medication, strong opiates to reduce the pain because she felt that she needs the opiates. And again, was sent home after about 2 to 3 days. And then again, after 2 to 3 days, suddenly the pain started going from head, upper extremities, started going down to the lower back and the lower spine. And this was a situation, and for about a year, they said maybe it's muscles that are being putting pressure on the nerves, and this whole theory, but no one had any idea what's going on. And then she went to another acupuncturist, a colleague of mine, and she started treatments there. And again, the treatments were actually making the situation worse and worse and worse. And she was, for the last year, searching for something to consult her, console her, and help her with the pain. Nothing was helping. The medication was helping for a few hours, and then it would appear again. A few hours, and then appear again. And then what happened? And then, so this colleague decided, well, I don't know, maybe something with your nerve system is out of balance, and he sent her, he referred her to me. And she came to me about 2 months ago. It's very, very fresh, this patient. And when we started in the intake, we started speaking. And we started speaking, and first of all, when diagnosed, first of all, I was told that there was a lot of tension on the liver channel. A lot of tension, she was on the liver channel very, very much, very, you could say, full, a lot, and choppy as well, and wiry, okay? But there's a lot of tension there. And there wasn't a free flow, a move flow. And then also, when you do Yamamoto's diagnosis, we have a lot of areas of diagnosis in the neck. And when I just touch the neck on both sides, without even going to the specific organs and channels that we have on the neck, according to Dr. Yamamoto, I started seeing that the sternocleidomastoid muscle was in a lot of tension. Okay? And one of the things is that her hand, she couldn't straighten her arm. Okay? And we started the treatment. The first, she told me the whole story with tears, crying, saying Nev's no answer. He's become a liability on a family, and she wasn't like this. She spoke that she has a son, which is about 3 years old. 6 years old now. And then she spoke a bit about what happened during the labor, that she got epidural, and again with the epidural something went wrong, and after the epidural she had headaches, but then it disappeared, and etc. And etc. Told me how the whole labor situation was very traumatic for her. Okay, and how the lumbar puncture that she had after the lumbar puncture with the epidural, for about 4 to 5 days, she had to be laid down because there was kind of some of the fluid came out of the spine. So that the spinal fluid came out, and then they had to leave her relaxed because every time she stood up, she got these dizzy spells. So they left her for about 3 to 4 days, 5 days lying down. And after, when she was feeling better, she went home. But after that, it passed away and never came back. And then with her hand, going back to the idea of the hand, and then so the first intake I diagnosed that she's in fight and flight situation. So the first thing I done actually the battlefield acupuncture, or maybe more the NADA protocol of the ear, and a few points not on the scalp at this moment, throughout the body to calm the liver, to calm the nerve system. Points on the liver mainly. It was liver 3, liver 9 point to regulate the flow of qi and blood. And also, I palpated the neck and I found that the liver organ was very, very tender. So I needled the liver organ. Now, just to go forward, Yamamoto kind of connected the liver organ to what you see here is a picture of Yamamoto's cranial nerves. And he connected the liver organ to the vagus nerve. And that was the first time I ever heard of the connection between the vagus nerve and the liver channel. And that was about, like I said, from 2008, 2009, around when I learned from Yamamoto. But I never tried to dive deep into this, go down this rabbit hole to understand how he connected. And a lot of times when you ask Yamamoto questions, how he connected vagus nerve or the cranial nerve to certain organs, he gives an answer that basically I never ever had full understanding of his answers. Okay, but that was the first idea of this going down this rabbit hole. But I never decided to really take that leap. Okay, and still with the patient. So when I palpated the neck, the liver channel was a lot of sensitivity. Now I'm going to reverse back 2.5 years, about 2 years ago, what happened here in Israel. Okay, and then how everything started to connect. To when the war broke out in Israel, because I were after about a month of war in a department that I work in, we started seeing a lot of soldiers coming into for the rehabilitation after being injured in the battle. And a lot of the major complaint was actually less the pain or the fragments that might have been from explosions and all that in the bodies, but actually the main complaint was that they're not sleeping well. And they're always having these flashbacks. And they very, very feel that they're very stretched out and they're very alert. And they kind of the nerve system is hyperactive. And again, so here already then I started using the NADA protocol to relax them, mainly the battlefield to relax them, but there was reducement in the stress, and actually the nerve system started to regulate and calm down. But something that was, because I mainly practiced Yamamoto, I started seeing that the neck area was very tight and very tender, even by putting slight pressure on the neck. They felt mainly in the area of the liver diagnosis, which is actually, if you take the 3 trigger points of the sternocleidomastoid, the center trigger point. And I felt every time I just palpated, even slightly, it was very, very tender. I started working with this NADA protocol, a battlefield protocol, and actually relaxing the neck with the Yamamoto, with the vagus nerve, mainly the sternocleidomastoid. And what happens every time I done a session, I see them 3 times a week, because that's the times that I work in the hospital. And that night, they always slept well. And slowly, slowly, it started accumulating, and they were sleeping a lot better. They felt they were more nourished. They actually felt that the tension in the body or in the nerve system was reducing more and more and more and more. Okay, so already there, I started seeing the clinical connection between the vagus nerve and the neck diagnosis. And slightly, at that moment, after about a month, I started saying, okay, what is the connection between the vagus nerve and the liver channel, or more, I started looking for the information of the connection between neck, in those days, stress, the connection between the parasympathetic and the sympathetic nerve system. And then I started jumping down and finding more information on the importance of the neck diagnosis, or the area of the neck of the Japanese Kiko style acupuncture. Kiko style of acupuncture of the Japanese, and she speaks a lot about the connection between the neck, the sternocleidomastoid, the accessory nerve, and Parkinson's as well, but also by working through the neck. She was here in a seminar in Israel. She spoke about reducing and imbalancing between the parasympathetic and the sympathetic nerve system, how it regulates the two, or mainly works through the parasympathetic, and what I understood in that seminar. So I said, okay, here's someone who speaks about the connection. And actually, at that time, I was working as well, seeing the clinical effect on the patients. So going back now to our patient that I spoke about, what I started seeing that there's this very strong tension in the area of the neck. And then on a second session, I actually asked her, but what about your hand? Don't you feel any pain in your hands or in the fingers or anything? I said, no. And they said, oh, but my hand's been 15 years ago. It's a different story. It's got nothing to do with what happened now. I said, okay, can you tell me what happened 15 years ago? I said, yes, 15 years ago, I was in a car accident, a kind of fatal, not fatal, a car accident, a severe car accident. And she said, yes, it was nearly fatal. I nearly lost my life. And I was resuscitated twice after the car accident. I said, oh, okay. It's something here that's got to do with trauma. And then she said, yes, I was okay, resuscitated. I was in the hospital for about a week. And then I had a pulmonary embolism. And again, I was resuscitated again. So we had, in a period of about 1 week, she was resuscitated 3 times. Okay, she nearly lost her life. But now when she acknowledged, she said, oh, it's nothing. But that already started triggering the idea that there is some trauma which is stuck in the system. And we have to start working with this trauma. And because that trauma, and then I said to her, maybe what happened when they done the spinal puncture to see if you have meningitis, I think it triggered off your whole nerve system. And he said, what do you mean? I said, well, think about the nerve system. The nerve system constantly is telling you a story. Okay, the sensory nerve system is constantly telling you a story, and you react into that story. And some of the information you might be aware of, but some of that story that's been told is kind of in your subconscious. What I believe that you might have forgotten what happened or not acknowledged what happened, but your body still remembers it. And what happens, your nerve system actually, when you had the lumbar puncture, it actually triggered off that fight and flight and put you in that situation of a trauma. But in your case, it's not, you don't see it as a PTSD or post-trauma, but actually your nerve system is actually indicating in some manners the idea of severity of pain. And then your nerve system is in axis, very much activated. So before we go into even starting to treat or tonifying or strengthening, the first thing we have to do is actually relax your nerve system. And also take into acknowledgement that I said to you, one of the reasons I feel that every time you go to physiotherapy or go to even massage therapy, it actually makes the situation worse, because actually what's happening, they're actually massaging your nerve system. But if you think that in embryology, the nerve system and the skin develops from the same layer. So every time you even put tension or friction or massages on the area of the skin, you're actually triggering the nerve system. It's maybe at this stage, your nerve system cannot hold or sustain this for too much. It's too much stimulation. The same happens with needling. And I said, okay, when you went to my colleague, what was he doing? He said he put quite a lot of needles, but every time I felt slightly better, but then it got worse. I said, okay, maybe that's the trigger. We triggering too much the nerve system. We have to relax the nerve system. So we only are going to work with around 3 to 4 needles. So the main points, we're working on the liver and relaxing the neck through the vagus nerve of Yamamoto. So, and slowly, we went slowly, day by day. We've been for about 3 months. The pain has disappeared. She's still in kind of trauma. When something starts appearing, she's kind of scared that she's taking a step back. She still has an emotional state, But actually what is happening, the pain is starting to reduce. Slowly, we started to even tunify. We started to use more scalp acupuncture points to regulate the nerve system. And slowly, the tension, the pain, and everything started reducing more and more. Without even targeting, Yamamoto has also the target zones of the areas that you want to affect. If you have lower back pain, you have a point for the lower back pain. If you have a point for upper neck, you have a point for the upper neck. Okay, but even just reducing it with 2 to 4 points that regulate the channels of the liver. So now, to explain more about this general idea, how maybe the vagus nerve is connected to the liver channel, we'll go, and what I started seeing is saying, okay, let's start looking at the vagus nerve, polyvagal theory, and how they both connected. So let's look first at the channel itself. If we look at the channel itself, it starts from the big toe, runs throughout the inner thigh, okay, inner thigh right up to the genitals, connects with the genitals, the main channel. From the genitals, it goes into the abdomen, connects with the gallbladder, the liver. Okay, from there, goes up through the throat, through the eyes, and then to the brain itself. Okay, so that's just, and then also that's the main channel, but also has the inner channel. The inner channel connects with the stomach and with the lungs. Okay, and also that area of the upper GI pericardium. So we actually have a channel that kind of starts to connect all parts of the body, the upper area, the middle area. Okay, stomach, you can also look at the stomach spleen idea, concept. We have the connection with the throat. We'll see what also plays out very much in this polyvagal theory and the connection with the vagus, and we have the connection of the brain. So just look at the channel itself. Now, let's look at the vagus nerve, okay? First of all, what I want to speak about that it's known, and I remember when I was in school of acupuncture, they spoke about, I also done sports therapy, but I studied sports therapy. And I remember also when I was in acupuncture school and also in the school for sports therapy, they spoke a lot about the connection of the vagus nerve for regulating the parasympathetic nerve system. And actually, when there's innovation of the vagus nerve, the parasympathetic nerve system is functional. Okay, think about it, that now we innovated the vagus nerve, it actually innovates all of the digestive system. And then what happens? We come into a situation of rest. I like the word more rest and recuperate. It's not only rest and digest, it's actually rest and recuperate. And then actually when that is activated, we actually have that idea of relaxing, we're more calm, we're more socially engaged, because we're actually in a state of relaxation. Now, let's go into the idea of the channel. So the channel starts, if you look at the vagus nerve, it starts from the brain, from the area of the brainstem. Pericranial nerve number 10 starts from the brainstem. From the brainstem, it goes down, innervates the area of the larynx, pharynx, okay? The area of the throat. Continues down, innervates the area of the heart, lungs. Then goes below the diaphragm, and then all the whole digestive system, okay? Liver, spleen, gallbladder, intestines, etc. But all of that is being innervated by the vagus nerve right through the whole digestive system. So again, right here in the idea, you can see very similarities in the concept of which areas the main channel and the vagus nerve separation. Now, the idea is also, if you think about the vagus nerve, the word vagus is from Latin, from the word of wonder, okay? All the time we're discovering more branches and more branches, but it's a whole area that actually has a lot of branches. And think about, now go to that concept also of the liver, that the liver also connects or regulates in some manner the flow of qi in all directions. Whatever goes up, goes down, or to the sideways. The same, think about the vagus regulates whatever goes down, and the heart rate, the throat, the lungs, the breathing, as a connection with the digestive systems. You could see the flow in that manner, the flow of qi in different directions. Okay, so, and that's another concept. Now, just to a general, very fast intake of this polyvagal theory. Polyvagal theory has got to do with emotional state, and it speaks about that actually situations of emotional trauma or PTSD or traumatic incidents get stuck in the vagus nerve. So, right, we said we have the activation of the sympathetic nerve system, where I actually found it's connected much to the liver, to the bladder channel. Think that when we have activation of the sympathetic nerve system, what happens? You could say our Wei Qi flies to the external parts and we puts us in a protective mode. All the blood and Qi flows towards the muscles and makes us more very, very alert, more attentive, and kind of in a survival mode. Are we going to fight or are we going to flight? Okay, we're in that mode. In the West, we have a lot of activation of that situation. Okay, so that's and also if you look about where the branches come out of the sympathetic nerve system, they sit on the spinal cord, very much close to the idea of the shoe points of the bladder, the idea of the shoe points that come from the bladder. And also we know that the bladder, or we could say the Du channel, is also an idea of the brain area in some manner. So that's the activation, puts us from the spinal cord, the yang comes to protect us, and now we're in a protective survival mode. Okay? What the polyvagal theory speaks about, that actually if we go in a histology, you can see it in histology and also caused to evolutional wise, we have actually, it comes from the brainstem and then splits into two parts. One part is called the dorsal part, which innervates mainly the low, everything that's below the diaphragma, okay? And then we have the ventricle part. The ventricle part actually innervates the area of from the diaphragm upwards. So it's the heart, the chest area, the area of the throat, and it also connects with other cranial nerves. It connects with the cranial nerve of the facial cranial nerve, trigeminal cranial nerve, okay, accessory cranial nerve, and also with the nasopharyngeal cranial nerve. So we have the connection again: throat, lungs, heart, face mimics, with the stomach and the channels, the small intestine channels, or whatever you connect them, these organs to. Why I say stomach? Yamamoto connected the face with the facial nerve with the small intestine, and he connected the trigeminal nerve with he connected with the cranial nerve number 5. Okay, and also let's go to the idea of the neck here. Okay, the neck here, we have a lot of we have window to sky points. So what are the windows to sky? It's actually the idea of opening up the window and letting everything balance out. Okay, homeostasis from what's coming out, in, and around, and a lot of points that affect the relaxation. Okay, and if you think they're around the sternocleidomastoid, now the vagus nerve, okay, comes from out of the brainstem, goes through the neck, goes under actually the sternocleidomastoid, goes to the clavicle, and then goes inwards and starts regulating all those organs that I spoke about. So any tension on the neck is putting kind of tension on the vagus nerve and then activating the vagus nerve, or making it not activate in the correct manner. But back to our polyvagal theory. So we spoke about the ventricle part. Now, if we look at histology, the ventricle part of the vagus nerve is myelated, has myelin. It's coated by myelin, so it has a faster effect on the patient, or faster effect on us as human beings, but also that we can control it, or have connection with it, or work with it, okay, in some manner. Okay, so we can calm ourselves down with breathing deeply and exhaling very, very slowly, taking deep breaths and exhaling very slowly. We're actually working through the vagus nerve to regulate and calm ourselves down. And that's going to also influence the heart rate and take the heart rate down. Also playing with our vocal cords, relaxing our vocal cords or massaging our face. We're actually activating it and allowing us to move from fight and flight to also more idea of relaxation. And then we have the second part, which is called the dorsal part, which is unmyelated. And the theory goes that the unmyelated area is got to do from the days that we were reptiles, okay? Evolution-wise, when we were reptiles, what happened when a reptile felt that he was under attack or he could not sustain the stress for too long? It would shut down, freeze, play dead to protect itself. okay? And that we have no control of. Because it's unmyelinated, we have no control of it. So anything that's happening in that area, we have nothing that we can control. So the theory goes to speak about that we have traumatic incidents, and then they get stuck in the dorsal part, okay? And then you could say activation of the parasympathetic nerve system, and it gets stuck. And then what happens, or you could say when the patient fight and flight, and suddenly he feels that he can't sustain pressure or stress for too long, and it just detaches itself from what's going on, or faints or plays dead, or detaches itself. A few minutes, closes in, have more depressional feelings, leave me alone, I don't want to know, I'm not in protective mode, I'm more secluded and with myself. That's more of the part that is activated when you have trauma. And it's exactly what happens with post-PTSD. The nerve system is being activated too much, the body feels it can't sustain it, and then this trauma gets stuck, but it gets stuck in the part of the dorsal horn. And then every time something in that story triggers off, or not a fight and flight situation, but more of a protective, let me rest and not rest and digest, but freeze. Because if I freeze, I'm going to protect myself or kind of detach myself from the situation. And that's what happens in PTSD. So that's the theory speaks about more that it's got to do that freezing part comes more from the dorsal part. Just so you understand what I'm speaking of, it happens to us all day. We switch from sympathetic to parasympathetic constantly throughout the day. And what do I mean? If we feel the sky's the limits, that's the ventricle part of the vagus nerve. So we're going out with friends, we enjoy in the evening, we very socially engaged, we want to be in communication. Okay, and then suddenly, for example, our friends start speaking about a topic that I'm not familiar with. I've got no idea what they're speaking about, but they work in the same workplace and they're speaking about a topic. What happens? I start secluding myself. I start withdrawing from my connection with them to myself. I'm actually moving from ventricle to dorsal. Okay, and slowly, as the discussion gets on, I start feeling very, very bad with myself, kind of depressed. I just want to go home, just want to be in bed, leave me alone. Okay, I'm actually secluding myself from the environment. Okay, and then I go home, and I actually went home with a bad mood now. So I feel very, very bad. Okay, and that's actually activated the dorsal part. And then I lay down in bed, and I wake up in the morning, and I say, I don't feel like going to work. Leave me alone. Okay, leave me alone. I don't want to go to work. That's it. I prefer staying in bed today. But slowly, what happens? Say, okay, you know what? Let me get up, I'll brush my teeth, okay? And then we actually switching from dorsal to actually sympathetic, which is starting to push me out of bed, okay? Sympathetic, I brush my teeth. Slowly, I go drink coffee or tea, whatever, or do my stretches. But slowly, the sympathetic is starting to be activated, starting to give me a kick in my ass to start moving on. And slowly, from the time I got out of bed to the time I have to leave the home, I feel great. Okay, I'm optimist. The life is amazing. Okay, I mean, sky's all the limits. Okay, that's I move into ventricle. I'm more I'm actually happy, relaxed, and the sky's the limit. And that's generally what happens to us day to day, just not in the idea of trauma, but the moving from sympathetic to parasympathetic to ventricle to dorsal, just in that feeling. But the idea is that trauma gets stuck. And trauma keeps triggering that fight and or not fight and flight. In this case, gets stuck in the vagus nerve and keeps triggering. And we do speak about that idea that trauma gets stuck in the kidney, and we have the connection between liver to the kidney. And then actually, if you have connection between the liver to the kidney, we also have the connection between the liver, the kidney to the heart, to the pericardium. So we have also all that idea of the emotional state. And think about the liver channel as a general. It knows where the chi and the blood need to flow. So when it gets stuck, we have a stagnation. And in some cases, stagnation might be pain, okay? Because we don't have a flow of chi and blood in different directions and showing up as pain. And in some resources or some ideas, it might be emotional trauma, okay? Because that's where the pericardium comes in, which is the protective part of the heart, the envelope that protects the emotional state of the heart. So, and the connection between the pericardium. So we see the connection there, also with the channel, of the idea of the concept. Now, when we want to, the liver also allows us to trigger off the sympathetic, because we need to be in fight and flight. Okay, so it goes of the chi and blood to flow to the outer extremities and put myself in protective mode, which is good. And then when we out of the protective mode and we want to sustain it, that actually we want to withdraw, come into more relaxed state. So the liver is actually the regulator that regulates all these parts. So think about that movement that I spoke about, the vagus nerve that we moved from ventricle, which is social engagement, to dorsal, where you feel bad. That's the liver kind of shutting down and secluding myself from the world, or in some stagnation. And then then the vagus then actually kind of communicates on you with the bladder channel, or you could say with the sympathetic, kind of give me a kick out of the ass, and we go into that loop day to day. So that's the general idea between the connection between the estimated polyvagal theory and the vagus nerve, and that idea of how Yamamoto connected the vagus nerve to the liver channel. So that was the idea. I started looking into that information, and by working through the neck, how we managed to regulate everything. So, right, Yamamoto scalp acupuncture technique is very, very useful for pain management and neurological disorders. But I've actually found in the last year or last 2 years that it's also very, very effective in emotional state, or even helping patients overcome, or helping them live with the PTSD, makes them more relaxed or kind of livable with the traumatic incidents. And then go back to our both patients, also the soldiers that I started seeing in the hospital, but also to our patient that I spoke about, how by working and regulating and relaxing the neck, and the connection of Yamamoto to the vagus nerve, the relaxing the vagus nerve, and the connection of the ear, because the ear, we speak a lot about the connection between the vagus nerve and the ear, and we have the NADA protocol, or the battlefield protocol, how they integrate and relax and work together. But just to go to the idea, so how liver doesn't do the functions of each organ. It assists in what the functions of the organ does. Because if we go to the spleen channel, what does it do with the spleen channel? It regulates the flow of chi and blood and helps in building chi and blood. Okay, if we don't have any wood energy flowing towards the spleen is earth. It's heavy. It's going to be stuck. Also, the stomach won't be stuck, won't be able to move. So that wood energy allows it to move, and then allows the flow of chi and blood to move up or down, or and the same with the stomach, allows the chi to go down. So that's one connection between, it aids in that idea. And it aids the pericardium in actually pumping the heart, and also aids in the lung in breathing. Okay, that's the flow of chi in all directions, and the flow, getting better chi flow in the chest. If we have better flow in the chest, we can breathe better. We can also relax ourselves better. Okay, think about the idea also of the pulse. Okay, basically, why do we ask patients to exhale a lot of times when we insert the needles? Because it's less painful. Because actually, when you exhale, you actually activate in the parasympathetic nerve system. And when you inhale, you activate in the sympathetic. So think about the lung that connects between the two. So the vagus nerve, or you could say the liver channel, regulates the flow of chi and blood in the area of the upper GI, or assists in regulating the chi, because it has the directions. It goes up, now someone has to push it down. Think about the general. What does a general do? It knows where to spread the forces, so everything will work or run freely throughout the body. And also think about the idea of the liver. What does the liver like to do? It likes to flow or move, and move very, very slightly. If it has a lot of wind in it, it's going to kind of, it's going to push us out of our state, and also cause emotional mania, or unrelaxed, or fight and flight. But when it's flowing very, very smoothly, we feel more relaxed. Or when there's no wind, we kind of get stuck, and this can become very, very more irritable. Like there's a heat wave and there's no wind flying, we very, very irritable, because our liver is not flowing in direction, kind of a stagnation. Okay, and then we have the connection of the kidney. The kidney and the liver have essence. Okay, actually liver channel allows the essence to come out. So think about the come out and then spread throughout the body. Now think of the idea of the kidney. What does the kidney have? It's also connected to the marrow, also connected to the nerve system. It's the memory, okay? So the DNA, the memory. So remember I said the nerve system constantly tells you a story. So think that your kidney is constantly telling you a story. So any traumatic incidents get stuck there. And the vagus nerve also has a connection to the kidneys, and also the liver channel connects to the kidney. So if I had when I was an incident. I was riding my bicycle and I smashed into a car. And for example, I broke my hand. Okay, and the car was orange. And every now and then I see the color orange without even knowing, with a subconscious, my brain or my kidney kind of remembers that. I kind of feel uncomfortable or kind of a bit slightly irritable. But that's my nerve system constantly telling me a story because it triggers off that memory. Okay, so that's the idea of the essence that's stored in that essence, or the DNA, or what I remember. That's the connection between the prenatal chi and the postnatal chi. And then we move to the idea of the liver that regulates the flow of the bladder, or assists in the bladder function. In our case, it assists also in the sympathetic innervation of the sympathetic nerve system, or activation, and allows me to move from sympathetic to parasympathetic state, the liver. And of course, all I spoke about, the regulation with the pericardium, or the regulation of flow and chi of blood in the upper extremities. So if we think about it's very on the edge of the tongue, like in our courses lately, in the last year and a half, we've started to bring this idea of the clinical experience, how Yamamoto we found is very, very effective, not only managing pain, and not only effective for neurological patients like stroke or Parkinson's or whatever. We actually started seeing that it's also very, very useful for regulating or work with patients undergoing stress disorders, or under a lot of stress, or under anxiety attacks or panic attacks. And how sometimes these panic attacks can be more physical because the subconscious is triggering a physical state and not something emotional, because that's what they interpret to respond to it. So we also go deeper into that in the last year. So this system, Yamamoto, is amazing because you can regulate the emotional state of the patient, the physical state of the patient, and just with little points. And that's with the ingenious, I think, of Yamamoto. We found these connections, and that was where it really tonified and strengthened my connection with the area of working of the neck, and etc. So going to the idea now, let's look at just the idea of the principle, maybe this idea that there's a connection between the liver channel and the polyvagal theory, or the vagus nerve, because they have some similarities in the function, okay? Both of them, any stagnation in the liver chi stagnation, liver blood stagnation might cause an emotional response, okay? And also that's the memory. We memorize that state, and that's also the vagus nerve kind of stores that idea of emotional state, or the memory of trauma, okay? And we do see also when we have problems with the vagus nerve, we might see digestive disorders, we might see pain throughout the body, unexplained pain, IBS, unexplained pain, bilious attacks, anything with connections, again, with the ear, okay, digestive system with the ear, tinnitus, and etc. But also, because the vagus nerve also connects to the inner ear area. So there's also another connection why digestive system and the ear, and we have the liver yang blazing might cause tinnitus. Again, so we have that connection as well also, and how regulating the vagus nerve allows us to regulate the ideas and the concepts in Western terminology, the idea of what we're doing when we regulate and are working with the liver channel. Even just working with the liver channel helps you relax the patient. We know that because it regulates the flow of chi and blood. If we regulate the flow of chi and blood and we make it very, very smooth, automatically our muscles relax, our ligaments relax, our breathing relax, our voice goes down, we relax, our mimics of our face relaxes, and we feel great, and the sky's are the limits. And when we relax, we also have a very efficient or movement to fight and flight. We have to now work in survival mode. We have to go to work, but we're actually going to work because we're happy to go to work. And that allows us to go to happy to work and not, oh, I have to go to work because I have to bring an income. Because if we're going to work, we have to bring an income, kind of we get stuck in a trauma, okay, of that idea of the memory, income's important, puts stress and keeps triggering up a state of fight and flight, but not in a positive manner. And the liver, when it's regulated, we feel great. And that's what happens also in sports. We actually socially engaged, but also we very in kind of fight and flight. But we in a competitive mode, but in a happy competitive mode. So that's the movement between so also the sympathetic nervous system will regulate correctly when we have that state. So generally, we can see a lot of connection between the liver channel and the idea and the concept of the vagus nerve. And I really, in the last year, it's changed my clinic, this concept and this idea, because I've actually managed for myself to translate how I think that the liver channel works, and then I can translate it to my patients so that, you know what, it makes sense what you're speaking about. So this is just an idea, a hypothesis that I see the connection. Maybe someone will see it differently or contradict me. I'm sure there will be people that contradict me, but this is from my clinical experience that I've been seeing the last 2 years. In a clinic, in 85% of my patients, it works. That means there is some connection from my practice, and I see a lot of patients in the hospital and my clinic itself, but that's my feeling. So I hope you understand this concept more. I hope broaden your mind a bit more. Thank you very much. I'm just going to open up. If anyone has a question, just jump in and ask a question. And thank you for coming before, but if you have any questions, just jump in. Okay. So again, thank you all for coming. I don't take it for acknowledgement that you came to listen to me. I hope you learned and you hope it broadened your mind a bit more and you can start working with this concept. And if you're interested in learning more about this technique of Yamamoto, I put in the chat the link to the course that will be coming in Oakland in October. So you can press on the link and sign up or get more information, learn more about the course that's coming up in October. I think it's 24th, 25th of October. So thank you very much all. Hope you enjoyed it.
I have a question.
Yes.
I'm sorry, I have a question. So I noticed you probably put the PowerPoint presentation in the chat, correct?
Yes.
Yeah, but I'm in a hotel and I am not able to download it. Is it possible you could